Hello, I'm Dr. Dennis McKenna, joined as always by Dr. Venditti, our hospital director, giving you the update from Albany Medical Center related to the coronavirus. Today is Incident Command Day 29. So we have an expression. Fred, thank God it's Monday.
Thank God it's Monday.
Here we are. We're ready to roll again. And before we jump into the numbers, we want to begin by recognizing the group we're representing here today, which is Corporate Finance. This is an incredible group of very dedicated professionals here. Not only are they involved in things such as making sure people get paid, they do our treasury activities, accounting, financial planning for the corporation. They play two really important roles in this coronavirus pandemic. I'll take the first one. This is Patient Access Week. Patient access folks are the first people often who meet that patient when they come in the outpatient or inpatient setting. They're an incredibly dedicated professional group of people. I've worked with them for years in the emergency department. They're among my favorite people here, and so we salute you wherever you work in patient access. Thank you for all that you do. And also our supply team.
They're our supply chain, absolutely, Dennis. And as you've heard me say over and over again, they've done a tremendous job securing our supply of PPE, personal protective equipment, masks, gowns, gloves, etc. They do an absolutely outstanding job.
Okay, so thank you to Corporate Finance wherever you may work. Let's jump into the numbers. We talk about the number of COVID-19 positive cases in 5 counties: Albany, Schenectady, Rensselaer, Saratoga, and Columbia. Last Friday, we reported the number was 618. Today, that number is 726. I always want to remind you there are many people who have tested positive, who've never come in the hospital, in fact, the majority of them, and also there are many who have fully recovered. So that represents about a 6% increase each day since Friday. However, as you'll hear, that has not necessarily translated into the same number of increases on the inpatient side. You may hear those numbers go up in the next couple of days, and that's because there's going to be a new outpatient test location for COVID-19. I want to make sure I get the information correct here. It's going to be at the University of Albany campus. It's going to be on the Colonial Quad, and it's going to be open every day from 8 a.m. to 6 p.m. We know the public watches these videos, so let's give them the number. It's 888-364-3065. So it's 888-364-3065. That's where, if you think that you have to be tested for COVID-19, you call that number. They'll prioritize you based on certain criteria. There'll be a scheduled time to go. Albany Medical Center staff, along with St. Peter's, will be working that tent. We thank our workforce who's part of that process.
This is going to be really great, Dennis. You know, it's going to be a great service for the public. I would like to take the opportunity to remind our staff that we have availability 24 hours a day for you to go to Employee Health Services, 7A to 7P to be evaluated and tested, or from 7P to 7A in the hospital on the 4th floor in the M building. So for all of you working here at Albany Med, if you think you have an issue that needs to be tested, come to Employee Health Services, not the drive-through.
Okay. So we talked about how the outpatient number testing may grow, obviously. What's happening here inside the hospital? On Friday, we reported that we had 45 patients in the hospital being treated for COVID-19. Today, that number is 61. So we've gone up by 16 since Friday. Since Friday, we've had 8 people who are discharged. That's good news. We've had people come into the hospital 2 different ways. One way is locally, and the other way is transfers. Interestingly, what we're seeing is that the number of people from the region who got admitted to the hospital since Friday with COVID-19 is 7. So that number, thankfully, is not going up a lot. However, that gives us an opportunity as a hospital to take on more transfers, and we took those in. And Fred, I think you have an update on that.
I do, Dennis. So for the region, since last Tuesday, we've actually taken in 82 transfers. About 37 of them have come here to the medical center, about half critical care, half on the floor, on the med-surg floor. Our partners, Saratoga Hospital and Columbia Memorial, have also taken some patients during that time frame as well. And the fact that the growth in patients from our region has been relatively slow, as Dennis said, allows us to continue to take transfers. So today, actually in flight, Mike Daly tells me that we have 13 already on the road, and we may take as many as 30 into the region, with a good chunk of those coming here to the medical center, but also to St. Peter's, Ellis, and other hospitals in the region.
And these people desperately need the help, and we're glad to provide it.
Absolutely. They're incredibly grateful. I was on C2 this morning. Two of them are going home to Queens this afternoon. We've arranged cabs, I guess, to take them home. They're really happy to be getting well and going home.
And speaking of going home, it's important to point out that since we started testing people for COVID-19 in the outpatient and the inpatient setting, almost 200 have tested positive. Of those, 136 of them are home. So the majority of the people who've been tested have either never come in the hospital or been treated successfully and have gone home.
That's right.
Speaking of the transfers, I want to point out something. These people come from downstate, and we don't allow visitors into the hospital unless there's certain very rare circumstances. So we're accommodating that by allowing those patients to talk to their family members downstate via iPads. And this is great because it gives them a connection with their family, and it keeps those patients' family members out of the hospital. And then when it's time to be discharged, Fred, what are we doing for them? For the patients who have to be discharged home, who are ready to go home?
When we're sending those patients home, we're sending them home with their medications that they need to complete the course, let's say, of Plaquenil, if they're on Plaquenil, and we're arranging that transport for them to get home back to Queens.
That's wonderful. So the workforce that's caring for these patients is obviously multidisciplinary, and we know that the nurses have done an incredible job, and nursing reports up to Dr. Venditti, and I'm sure that he would join me in saying what a remarkable job they're doing. In fact, we're going to have a video from one of those nurses in a second.
That's right. The nurses really have done a tremendous job, particularly on those floors where we have our COVID patients, C2, C4, D3 North, and the MICU. Dennis, they're proud to be doing this for the people that they're helping. One of the leaders, Jen Miller, a nurse manager from C4, I think wants to say a few things to us.
I've been a nurse at the medical center for 30 years, and I've spent my entire career on C4 taking care of infectious disease patients. My team and I have been taking care of COVID-19 patients for 5 weeks. C4 is a specialty unit equipped with negative pressure rooms. We are adhering to visitor restrictions unless there are extenuating circumstances. We have iPads on the unit so the patients can FaceTime with their physicians and nurses, family, and friends. Our nurses are equipped with the proper protective equipment, a mask, face shield, a gown, and gloves. My team is an amazing group of men and women who have the desire, compassion, and expertise to care for COVID-19 patients. We've been receiving well wishes and recognition from our peers here at the hospital and the community, and we appreciate your support. Wash your hands, social distance, and help flatten the curve.
Thank you very much to Jen Miller and her incredible team and all the nurses. In closing, we'd like to thank the Albany Center Gallery, which has produced 4 incredible murals. They're big size, 4 by 8 feet. They're original works of art that they've now displayed outside the medical center, expressing the community gratitude. And this is another example of where we're so appreciative of how the community has risen in support of everything happening here at the medical center.
It's a message of hope, Dennis. It really is. It's fantastic.
Yeah, great. So that finishes our report here on Monday. We thank you very much for everything you're doing out there. We ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.